let's talk about cold emergencies. That brings us to this point in time. Tomorrow it is going to be freezing cold. We probably won't even have school.
We're banking on it.
You know, of course, don't get all happy because we don't lose our nice weather day.
But it would just be nice to us.
Yeah. So, cold environment is when you lose temperature faster. So you're starting to lose the temperature. Okay. It is essentially the same thing. To treat the patient, you get them out of the cold environment. You start warming them up. Okay. Blankets, heater. All right. Dry them off if they're wet. It's an important factor that's coming up tonight into tomorrow. That at least in the Metroplex, EMS workers are going to be very busy because we have a lot of homeless people in the Metroplex, especially in Dallas or in Fort Worth. There's a lot of homeless people.
Oh yeah, over there.
When you get out into that cold environment and you start losing body heat, okay, you've got to regain the body heat. The problem with tonight, it's going to be raining, okay? And when you get wet, you lose body temperature 25 times faster when you're wet. So you lose that body temperature quick, and you can go into, you can get hypothermia, right? Low temperature very quickly. It becomes life-threatening very quick, okay? So you got to, these guys have a high chance of having some hypothermia. Now, I'll go ahead and say it. I'm not sure if it's in your notes, but you'll hear this expression that you're not dead until you're warm and dead. It's very important, and you might see this in the ER or something. Let's say they bring in someone that's in cardiac arrest that's been exposed to the environment. All right, if they're cold, they will try to resuscitate them until they warm the body up. That's not mean you're not dead until you're warm and dead. They're going to continue resuscitation until the body is warmed up. And then they'll make their decisions. What happened with hypothermia is the heart rate will slow way, way down. The breathing will almost look absent, right? And the metabolism will go to zero. So you're not really using the oxygen that you have, okay? So there's a lot of things with hypothermia that causes the body to do that. You've heard of people falling in frozen lakes.
Yes.
I think the last I heard it was greater than 30 minutes. Underwater. All right? Pulled from the water, resuscitated, no neurological deficits. That means that they're perfectly normal.
Wow.
Now,
Oh, that's cool. That's
Yeah.
actually really cool.
everything just slows way, way down where you don't use it. They have problems, they probably have some water in their lungs, that other things, that they don't have to work through, but they resuscitate them. They got their heart started back. Now, that's not around here. The water gets really cold around here. It drops in the wintertime, probably into the 60s, 50s, okay, water temperature. But that's not cold enough to do what it does on a frozen lake. I'm talking about this type of water that, someone falls through the ice. So you're in the middle of the lake and the ice breaks. That's when you can walk on the lake with ice, okay? Around here, we don't get that. So if they fall in the water and they're submerged greater than 10 minutes, then it's no longer a rescue, it's a recovery. The water around here is not warm enough to do that. Okay? So they would drown.
What?
They would eventually die.
I thought when you die, like,
Because they're trying to like bring them back to life. Trying to drink the frozen.
Yeah, but that won't work. Eventually, after even in a lake like that, eventually after a period of time, you're not going to be able to resuscitate them. Okay, but the point is that anybody found outside or anything, if their body temperature is, if they're cold, you take a temperature and they're cold, or you just touch them and they feel really cold to the touch, then if they're in cardiac arrest, then you would resuscitate them through the process, and that you may see. So that's why I bring that up here. Okay. So remember, resuscitate. You're not dead until you're warm and dead. When we look at the different signs and symptoms of these cold emergencies, shivering is one of the first signs. The body starts to shiver. By shivering, it's moving the muscles and generating heat. Later down, you can get an altered mental status, lack of coordination. The more you get, the colder you get, the lack of coordination. You get all stiff. You can't move. Your cerebral function slows down. You get really sleepy. That's why they tell you if you're caught out in the cold environment, don't go to sleep. Stay awake. You're producing more heat when you're awake. All right? And so you get all these things because our fluid, we're full of water, right? Okay? So our joints are got fluid in them, so we get all stiff and everything like that. Keep that in the back of your mind in just a little bit about the fluid inside. This is why we don't want to rub our hands together when we get really cold. Or they don't want to walk, because the fluid inside could be sort of starting to freeze up a little bit. So, remove the cold environment. Don't allow the patient to walk. All right? Keep them warm. You've got to monitor their vital signs. Nothing by mouth, like, give them some coffee or something. Not really when you get them warmed up and then let them start taking fluids by mouth. Okay. Don't really aggressively. We can aggressively heat them up, but it's not like the cold emergencies with the heat packs. You wouldn't put the chemical heat packs there because they get really hot. But you could try to warm them up. Why are we putting colder heat packs over the femorals and the neck and the armpits? Yeah, because a lot of blood is moving through there. We're warming that blood up. We're warming the fluid up that's moving through those large vessels. Okay? So we want to do that. I would start an IV with warm fluid. I'd hang my IV bag by the heater, or I'd tape a heat pack around the tubing to warm that fluid up, so you're putting warm fluid in there. They get into the emergency department, and the same thing. They put the hugger on them. They start blowing hot to warm air on them, get a good temperature. This is hot or cold. This is where they would do the rectal temperature. They want to make sure that they have the right body temperature. So they go ahead and do a rectal temperature on the patient, making sure that you get the correct temperature so you can see if you're warming them up or cooling them off. And definitely monitor the vital signs. Like say, very slow pulse. 30, 40 seconds you may be having to check or you just might have to wait a whole minute. Their heart may only be beating once or twice a minute, 3 times a minute. So everything is sort of slowed down. It's just sort of down to its minimum bare necessity. And then if you don't feel a pulse, go ahead and start CPR. In that same way, you're sitting there and say, I just don't feel a pulse. So you go ahead and start CPR. While you're doing CPR, you start warming them up if they're unresponsive. So we have a couple definitions that we look at. Frostbite, okay? You get frostbite on the things that are exposed, the hands, the feet, the nose, ears, the face. So you can sort of get a frostbite on those as we get through, the things that are not exposed. And then when you look at this early, it's sort of a blanching or a whitening of the skin. Sort of get that. It's feeling cold. You start losing pain. Skin doesn't get hard. It still remains soft. And what you really want to avoid with this patient is for them to go over and try to rapidly warm them up, like hot water, on their hands or something, or rubbing their hands together. Because if you rub your hands together, that's going to generate heat, right? But you want to sort of avoid that. Sort of wrap their hands up and try to warm them up like that. You never want to really warm them up with hot water or even warm water, I would say. Because everybody's done that. Like your hands are real cold, you get them in warm water and they start to tingle and sting, right?
Do they feel colder for them?
Yeah, so try to warm them up a little bit more passively in this earlier stage. Here's sort of a picture of more extreme. Almost looks like a burn, doesn't it? See the blisters on the feet. What else do you know about the feet? Hit the light so we can see. Yeah.
And orange.
See the discoloration here on the feet? Also the swelling. Look at those toes, little sausage toes. So we got to look at that because of circulation, right? So you check that distal pulse. Make sure they have good circulation going through there. Make sure that anything that is wet is removed. You've got to remove the wet clothing for this patient and get that wetness away from them. You'll never be able to warm them up if they have wet clothes on. So socks and underwear, everything, get them, wrap them in blankets, start warming them up. Make sure that you don't pop these blisters. We'll learn a lot more about these type of blisters when we go into burns. Like this one here is popped. It just opens up everything for infection. So you can't try not to pop them. And obviously this patient's not going to want to walk, right? It's going to be very painful for them to.
Why is it all orange?
That's just the blanching of their skin. And that's the skin underneath. That's sort of fresh skin that's underneath.
Oh.
When those blisters tear. So, sort of a later sign like this, you feel the waxy type skin. You feel more frozen. You get the swelling. The blisters may be present with that. So definitely not rubbing in the hands and walking. As it progresses, hopefully you can get this stopped before you get into this. I mean, you look at this. This is a very late sign.
It's like a Doppler radar.
It looks like it's an
It changes color.
What about, see this discoloration down in this lower extremity?
That's bad skin.
There's not getting very good circulation down there.
At all.
Yeah. So you see the swelling.
Orange to purple.
I mean, so there, I mean, you don't even have to be in medicine. You would see those feet and go, oh, we don't want you to walk. That's going to be very painful. And as it gets, I mean, if we don't correct that, they're going to lose their feet, right? That's an impossibility to really tell. You reperfuse it, and who knows? I mean, it's not. I don't think it's that bad yet, where they probably would lose their feet. If once you start seeing extremities or they're going to lose that extremity. Like I watched this show about these guys who they climb Mount Everest, and they have cold injuries like that. Some of them came down, their fingers were black, and they would lose that. That's necrotic tissue, that's gone. You know, they're going to lose a finger or a toe or something, a foot. So So again, the same thing. Remove them from the cold environment. Protect them from future heat loss. Make sure that when you go through this, that you're protecting them and they're not going to lose more body heat. Okay, that's very important. You once you start warming them up, you keep them warm. You don't want to cause that imbalance again, right? So I tell you, this is a huge thing in workers outside. Like I'm working outside on Saturday. I'm on the ambulance on Saturday, and let me tell you, I'm going to dress for the occasion. The high is only supposed to be 32.
That's freezing.
You know.
Tomorrow is like 19.
Yeah. So you dress in layers. You want to make sure that you're well protected. Me, I'm going to protect this nice about his skin right up here. Right? Because you think about like EMS, you could be out on the road for hours before, I've been out on a 3.5 hour extrication before. Fortunately, it was during the summer, not winter. But so you've got to be careful whether you do that or you work outside to prevent these injuries. But cold-related injuries are fairly easy to take care of up until the surgical part of it. Like those feet, they may have to have surgery done on that. But for us, for right now, we're going to warm the patient, very gently handle them. Don't rough them up because the fluid inside, get them warm blankets. Remember in the hospital, in the ER especially, they have a place for warm blankets. They have a heater in there that warms up the blankets so we can make sure that we keep patient comes in cold, that we can warm them up. And then, like I said, we've already talked about, don't break the blisters. Be careful warming them up. Don't allow them to walk. Don't re-expose them to the cold. Don't allow them to rub, because the patients want to rub their hands. Their hands are cold and they want to do this. That's natural. So tell them, no, don't rub your hands. It could cause further damage. If you think about the fluid inside, let's say the fluid inside our hands, okay, the interstitial fluid, the fluid in between the cells, and let's say it starts to get a little slushy. You're really cold, it starts to get a little slushy. So take an ice cube and drop it on the ground. You see all the little splinters come off of it? So now you picture that on the inside of your hands and think about the tissue damage that's taking place there. It's just really rupturing a lot of cells, and you're going to get a lot more swelling and eventually pain out of it. Right? But overall, warm them up. Give them warm IV fluids. Like your scenario, you'd put a hugger on them, get them warm, get a rectal temperature, see what their temperature is. That's a baseline. Remember, baseline is what we do our treatment on, so you do that baseline treatment. Okay? Everybody good with cold?
Yep.
Not very difficult at all. All right.